The doctor is in. According to the American Cancer Society, colorectal cancer is the third leading cause of cancer-related deaths in men and women in the U.S. Here to give her advice on prevention is Dr. Charlene Lepane, a gastroenterologist from Advent Health Medical Group and Central Florida Gastroenterology and Hepatology. Thank you, Dr. Lepane.
Thank you, Carissa, for having me.
So let's just kind of dive in on the stats of colon cancer right now in the U.S.
So it's just very concerning. The statistics that I looked at from last year, 2018, American Cancer Society said 140,000 people in our country died of colon cancer and another 50,000 from rectal cancer. So those are very disturbing numbers.
Yes, and is that something that you are seeing in your practice, a lot of unfortunate cases of this?
Unfortunately, yes.
And how do you typically diagnose colon cancer?
Most of the times we are diagnosing this by colonoscopy, direct visualization of the cancer, but there are a number of different tests that one can then have by their primary care physician that would raise a flag and then subsequently typically diagnosed by colonoscopy.
When people are coming in, if it's not a colonoscopy, that's sort of that preventative care, what symptoms would they be having that would say to you, okay, we need to look at that colon area?
That's a great question. So sometimes there are no symptoms.
Which is
and that's
why
what is
the
concerning.
numbers are so high, yeah.
So most cases you're going to have some symptom, whether it be fatigue, your doctor notices a new anemia on your CBC, your blood count. You may have some blood in the stool, either on the toilet paper. Do not assume it's hemorrhoids. Okay. It could be also mixed in the stool itself. Weight loss is a big concern, and even more than that is family history.
Okay, so having a family history of colon cancer. And with that CBC, not only should we be focusing on colon health, but we should be getting our regular yearly exams as well, right?
100%.
Now, with colon cancer, are the instances pretty equally spread among men and women in different racial groups?
Unfortunately not. Men are at higher risk. And we're actually seeing a trend. We're seeing younger people with colon cancer, and New York Times has a whole segment on this right now. We're seeing a lot of younger individuals with colon cancer. And that is one of the reasons why American Cancer Society last year recommended we start at 45 and not 50.
Okay.
And with regard to ethnicity, it is well known that African Americans have a higher prevalence of polyps for reasons we don't know. And subsequently those polyps turn into cancer. So.
Now, with the younger men, do we have a causation of that, why that's happening?
Unfortunately
We're
not.
working on it. People like you are
We
not necessarily
are
working on it, but trying to understand it and treat the best you can.
Absolutely.
Yeah.
We do know that there's an increased incidence of these new polyps, newer to us. They're serrated adenomas. They're very aggressive, and they tend to hide on the right side of the colon, and that is where we're seeing a lot more colon cancers arise from.
So just to clarify, young men, what is that age range? Is it below 45? Is it 20?
So 40 to 45 is where we're starting to see some of these cases.
Because I might not consider that young. No, I'm just kidding. No, but that is what we're talking about. When we're saying younger, it's not that typical, more mature population.
When you get to 45, it's young.
Okay. All right, now let's be, in all seriousness, risk factors for colon cancer that we need to be aware of.
Very concerning where our country is headed with obesity. So obesity is a number one. For me, age is number one for colon cancer risk, but obesity is such a growing problem in our country, and it's the central adiposity. It's right here.
Yeah.
And more so in men than women. Smoking is a huge risk factor.
And you wouldn't connect those two normally, but smoking kind of.
Smoking's a no-brainer, causes a lot of cancers. The other thing is alcohol use. So for women, less than 1 drink a day is considered okay, and for men, less than 2 drinks a day is considered okay. Above that, there is a direct increase. And the last thing I would say is that red meats and processed meats are definitely linked to colon cancer.
Colon cancer. Well, what about prevention? You say it's not too late to make a change. What do you mean by that?
So dietary modifications, try to eliminate red meat, choose some other source of protein, whether it's nice white fish. Get out and exercise. You should be doing 150 hours of moderate intensity per week.
Minutes, right? Not hours.
Minutes.
I'd like to do 150 hours a week. That'd be great. I think I got to be here, though. I know you'd like to run 150 hours a week.
No way.
So we're exercising.
So exercise, reduction of that alcohol, do not smoke. Think about wise choices. Think about what you're eating. Okay.
And what is the age that we should, be getting that colonoscopy with no family history or
45.
family history?
45. And unfortunately, it may not be approved because it has not gotten through all the societies at this point, but it has been proposed, and so I would expect that change to occur in the next upcoming 5 years.
All right, real quickly as we're wrapping, are colonoscopies as scary as some of us think they are?
Not at all.
Okay.
Not at all. I've had 2. The day before is the worst part, but we make this so nice. We have a Cadillac medication. We have an anesthesiologist in the room. We make it an environment where we want you to feel comfortable and come back.
Okay.
And is it safe? Yes.
Good. All right.
Yeah.
Well, thank you. Such very
you,
vital
Carissa.
information. Thank you, Dr. Lepane. For more information, you can seek out Advent Health Medical Group and Central Florida Gastroenterology and Hepatology, or visit the website ccalliance.org. Stick around. We'll be right back with more Bloom.